out to let him know. And we're going to move on to our next speaker. So that's the explanation for the rather abrupt ending of Dr. Nawaz's presentation. It gives me great pleasure here to introduce our next speaker, who is John Mills. John is a philosopher, psychoanalyst, and retired clinical psychologist. He's an honorary professor in the Department of Psychosocial and Psychoanalytic Studies, University of Essex, UK. He's on the faculty in the postgraduate programs in psychoanalysis and psychotherapy, Gordon F. Derner School of Psychology, Adelphi University, USA, and is an emeritus professor of psychology and psychoanalysis at Adler Graduate Professional School in Toronto, Canada. He's a recipient of numerous awards for his scholarship. He is the author and/or editor of over 30 books in psychoanalysis, philosophy, psychology, and cultural studies, and he is going to be presenting his keynote address tonight. And he's just a personal note. John is a good friend and supporter of the National Philosophical Counseling Association, and we welcome him to his presentation, which is I'm sure you'll all find very, very useful. The name of his presentation is Field Notes of a Philosophical Counselor. John?
Well, thank you very much, Elliot, for that kind introduction. Appreciate it, and I appreciate the invite. Yeah, I thought I'd tell you about my experiences over the years, and I'd be happy to open it up to any discussion at the end. The discipline of philosophical counseling was relatively a new phenomenon when I was in graduate school in philosophy. And given my training as a psychologist and psychoanalyst, I was immediately drawn to it. After the attention that Lou Marinoff received with his best-selling book, Plato, Not Prozac, I decided to hang up a shingle and see what would become of it. Before I tell you about my foray as a philosophical counselor, however, I want to go over just briefly some concerns I had about the fledgling profession since I started practicing back in the mid-1990s. Some early controversies over ideology and turf wars. Although some practitioners resisted lumping PC, I'll call it for short, into a psychological genre with its own specific methods, theoretical orientations, and techniques. I've always viewed applied philosophy in this format to be a form of psychotherapy allied with the helping professions. I further implored that the field should require conscientious practitioners to undergo training in mental health or the behavioral sciences with a focus on the technical and ethical applications of counseling others who suffer. This is largely the accepted view of most members of the National Philosophical Counseling Association, the founding organization of philosophical practitioners in North America. Despite adamant protest by some of the leading founders of philosophical practice that denied the role of human psychology and how it comes into play in the client relational encounter, I knew of these dangers all too well in treating adolescent and adult populations who are emotionally fragile or afflicted by ongoing mental distress. To attempt to separate out philosophical technique from the psychological variables involved in a helping relationship, or to assume that a purely rational or logical approach to philosophical discourse does not engage with a person's overall psychic reality, is to fail to consider how we reside in psyche, or our psi world, as embodied mind with desirous, sentient, affective, cognitive, and self-reflective functions that are largely organized as unconscious schemata, which influence our phenomenal experiences of the world. We could no more separate out components, processes, or parts of the psyche from the whole that encompasses them than we can live as a purely rationally detached cogito. The human mind simply is not compartmentalized in that fashion. To assume otherwise is to deny human nature. Likewise, denying the therapeutic benefits of philosophy as a psychological intervention, namely, that which impacts on people's existential lives and adjustment, is to insist on an untenable identity politics that tries to bifurcate professional disciplines into distinct categories and activities when they ontically interrelate in content, form, function, and purpose. Recall that psychology did not become a formal discipline until the late 19th century and was always considered an offshoot of philosophy as soul-making. We must remember it was Plato who was the first psyche analyst and who largely introduced Western civilization to the first account of how one engages in philosophical reflection and dialogue. Now in our modern age, such philosophical discourse applies to all things that concern human existence. And given people are in search of therapy for the well-being of their psyche, philosophical counseling cannot elude the very premises about human nature it seeks to inquire about and give counsel to. As a talk therapy that recognizes the restorative power of conversation and dialogue, to practice philosophy is to encounter the psychology of others' minds in all their complexity, hopes, wishes, defenses, internal conflicts, and pathology. Philosophical counselors can no more avoid dealing with psychological matters than can psychologists deny its indebtedness to its philosophical origins. Largely due to Marinoff's popular trade success and public marketing, philosophical counseling became the new flavor of the month back in the 90s. Soon other philosophers enjoyed public success and attention as a new cottage industry of publications came out with different theoretical and methodological approaches to philosophical practice. On one hand, it joined the self-help movement, where practical advice on how to live one's life or manage life problems appeared in typical self-help book fashion, where workbooks, exercises, and homework assignments and critical thinking and logic could be applied to everything, from how to stop worrying to living a more authentic life, hence reviving the existential tradition that had influenced the humanistic psychology movement. But on the other hand, applied philosophical praxis was slowly becoming a global phenomenon, amassing a cornucopia of critics from both within and outside the discipline. Turf wars, infighting, and rifts started to pop up by philosophical practitioners against one another and institutionally. But more seriously, by mental health disciplines who found PC to be an unwelcome trespass and exaggerated potential danger to public safety. Complaints were hurled around about everything from inadequate to inappropriate training, lack of evidence-based practice or validity as a method, to accusations of pseudoscience and alarm over harming people. And given that PC is not a regulated health profession, it continues to generate controversy about its ethical and legal standing as a legitimate form of human service delivery. Given that the health professions are now highly regulated in North America, the fine line between philosophical dialogue and therapeutic intervention becomes opaque and is often undifferentiated. For example, where I live, you cannot practice any form of therapy in Ontario without being a regulated health provider, as treating any cognitive, emotional, or behavioral issue constitutes an act of psychotherapy under the law, unless you dare try to pass yourself off as a life coach or a consultant outside the scope of a health discipline. Even unregulated counselors are at risk of being charged with practicing without a license here for any identified issue or problem a person presents could be said to fall under the purview of health. A note on my training background. Before any formal institutional governance of philosophical practice was established, including codes of professional conduct, certificate training programs, or the invention of logic-based therapy by Elliott Cohen, who sees the allied intersection between philosophical intervention and psychotherapeutic treatment to be intertwined. Philosophical applications to the therapeutic encounter often revolved around phenomenological, existential, and transpersonal approaches steeped within a humanistic healing emphasis. Before cognitive behavioral therapy became organized as a specific type of method popularized by Aaron Beck, I was trained in the 1980s in behavioral therapy, adapted from American behaviorism, and rational emotive therapy before Albert Ellis combined the two approaches as rational emotive behavioral therapy. While the former focused on how to get people to change or adapt their behavior to better suit their desired goals, needs, and outcomes, the latter was focused on how people thought and how cognitions intervened on their actions, not to mention how to deal with irrational emotions that got in their way. But I was also trained in competing modes of therapy that were dominant at the time, including Carl Rogers' client-centered therapy, now person-centered therapy, generally falling under the rubric of what we now call the humanistic psychotherapies, Fritz Perl's Gestalt therapy, and Eugene Genlin's focusing method, now passé, and the array of psychoanalytic therapies, classical psychoanalysis, analytical psychology, object relations, ego psychology, self-psychology, intersubjectivity, relational perspectives, etc. Now these are generically referred to as psychodynamic orientations. Now another offshoot was my training in the phenomenological existential tradition, following the philosophies of Husserl, Heidegger, and Sartre, which were largely introduced to American psychology by Ludwig Wittgenstein, Menard Boss, Viktor Frankl, Rollo May, and Irvin Yalom. All of this didactic and supervisory exposure was preparatory to become a clinical psychologist, and was a precursor and a requirement to enter into postgraduate training to become a psychoanalyst, which I completed years later. All of this predated my formal studies in philosophy. So when I was exposed to the new subdiscipline of philosophical counseling, I was naturally inclined to pursue it. Setting up a practice. When I received my PhD in philosophy, my career aspirations were to become an academic. But after years of applying for positions on the job market, I could not land a full-time tenure-track post. I had no other choice than to fall back on my original training and start practicing as a psychologist. But I moonlighted on the side by attempting to set up a private practice in philosophical counseling, thinking that I might attract a clientele seeking out this new form of intervention. Because the internet was not yet a worldwide phenomenon, I had relied on the good old-fashioned way of advertising my services through classified ads in the local papers. particularly targeting the youth and popular culture who may be seeking alternative forms of self-improvement methods that did not have the stigma of mental health stamped onto the new brand. Now, because I was a pauper at this time, living on a small stipend as a Fulbright scholar in Toronto and actively seeking employment, I had to see people in my apartment. Now, that is the first mistake anyone can do. Never invite clients into your own personal space, and never give out your personal phone number unless you want to be on call 24/7. To this day, I do not use a cell phone for any professional matters, as the last thing I want to do is give off the impression that I'm available to address someone's inquiry on the drop of a dime. I equally do not use email communications for the same reason, and when I do, it is to simply set up appointment times. I do not recommend relying on these modes of communication to discuss personal matters, only for the convenience of scheduling. As a general rule, if you allow for extra therapeutic matters to be discussed between sessions over the phone, text, or email, you'll be a slave to high maintenance, entitled, and distressed clients who simply want to suck off the tit free of charge. And you will complicate, if not defile, the professional framework. Anyone who has experienced that 3 a.m. crisis call will know exactly what I mean by insisting on having a tight treatment frame where all the expectations and parameters of your relationship with the client are spelled out ahead of time in the first session. Now, my first prospective client. After taking out such newspaper advertisements on my professional services, I had my first prospective client call me. He could barely speak English, and he had an Indian or a Pakistani accent, very hard for me to discern at the time. He said he had a problem with sex and wanted to know if my services were covered under the provincial Medicare program in Ontario. After I told him my services were private, he was confused because doctors here in Ontario are covered under our healthcare system. But after I explained that my status was not a medical doctor, he was somewhat relieved that I would not be prescribing drugs or surgery. As I continued to inquire about his desire to set up an initial consultation and what my fees were, he says, "Will you massage it?" I said, "No, buddy, I don't do that kind of thing." Then he continues, "No tushy?" Now I couldn't help just laugh out loud that this guy, when he's calling me for this reason. And I also was feeling foolish over, what I've gotten myself into. By the end of the call, I told him that I thought his needs would be better served by visiting a Jack Shack. He then understood fully what I meant. My first client, Tom, was the first to set foot into my apartment. He had seen several different therapists and was currently seeing a, quote, success coach to help with his business goals. It soon became apparent that he was doctor shopping, to use his term, and was in the process of interviewing other coaches and therapists. He had not heard of a philosophical counselor before and was curious about what I had to offer. He immediately came off as obsessional and needed to be in control of the session. Although he initially focused a great deal on his need for guidance and structure, particularly in wanting to be an entrepreneur in search of business coaching, he talked over my questions and simply wanted to be narcissistically mirrored. In trying to find a common focus for us to reflect upon, he continued to brag about how intelligent and wonderful he was. It may not surprise you that he was a sales agent, as the feelings he generated was like walking into a retail store only to be swarmed by copious staff. When I pointed out that I was confused about why he had come to see me, given his apparent talents and success, his persona shifted. When I suggested that his curiosity in seeing a philosopher must be about other reasons than merely wanting to start his own business, he let his guard down and told me in a rather stoically detached fashion that he felt a generalized sense of meaninglessness and that his life had no purpose. Finally, we had something to focus on for the rest of the session. In exploring his meaningless life in his relationships and at work, he reported that talking about these preoccupations and feelings openly, rather than keeping them as private thoughts, felt like he was addressing the real issues he had been avoiding with other therapists. But his grandiosity and entitlement sabotaged any hope that we could continue to work together. As the time was approaching the end of the hour, I suggested that he make another appointment so we could continue exploring these aspects of his life. Harry became demanding, and he said that he didn't want a clock watcher and that he wanted to go for a, quote, intense 2 to 3 hours, and I don't want to be charged for over the first hour. That's end quote. When I said that he did not inform me ahead of time that he wanted more than a 1-hour consult, and I had other obligations that day, he then wanted his initial consultation for free. I told him I don't work that way and he'd have to pay me for our mutually agreed upon fee when we had first scheduled the appointment. In short, he stormed off in a huff after throwing cash on the sofa. Now, in psychoanalysis, we would refer to this type of a person as an insecure narcissist, where grandiose defenses and bloated self-importance cover over deep feelings of inferiority, vulnerability, inadequacy, and shame. In his attempt to manipulate and intimidate me into buying into his pompous ultimatums and need to control the process, and hence resist in establishing a positive working alliance, he could devalue me and abuse the frame without having to face his own narcissistic limitations, and thereby succeed in continuing his pattern of avoidance and denial over the meaninglessness he bore and wanted to escape from. This is why the importance of the frame, securing a social contract, including the time period and being paid as expected, are the professional parameters that structure the work and provide containment when ambiguity and impasse inevitably enter into the fray. It obviously did not occur to him that he was sabotaging his own fulfillment in life by acting like an asshole in need of shitting on a bad object. My guess is that he's still squatting on the pot. When screening procedures go awry. After my first few attempts at receiving people in philosophical counseling, I realized I could no more predict who was going to walk into my consulting room than I could predict the weather. No one seemed to be suitable. All presenting problems were largely psychological in nature rather than engrossed in philosophical ruminations. Unlike my customary practice of never getting into long conversations on the phone, let alone discussing details of a prospective client's life history when they first inquire about my services, I decided that I may need to screen people better on the initial phone contact so I might be better able to discern who would not be an appropriate candidate for a PC. But I made the classic mistake of a neophyte by bungling such matters with a phone screening, therefore opening up a can of worms. Rob said he was attracted to my advertisement because he was educated in astrology, numerology, and the quote, metaphysical bases of the psyche, end quote. He wanted to impress me with what he referred to as his quote, tremendous intellectual power and creativity, end quote, despite soon learning that he was unemployed. In my effort to develop some kind of phone screening procedure, I asked him some basic questions about his presenting issues and what he would like to address if he were to come to see me. Before he would answer, however, he had some questions for me. He wanted to know my credentials, training background, years of experience, my areas of specialization, and my success rates, including statistics. I felt like I was undergoing a diagnostic interview. By some miracle, I must have passed his initial test because he then started to disclose the extent of his mental health background. He said he had been called depressed. Do you feel depressed? I inquired. He replied that he felt lethargic, isolated, and seemed like he had been, quote, roaming around in space for years, end quote. He was fired from his job as a secondary school teacher about 5 years prior and started to decompensate in his functioning due to helplessness and feelings of loss of control. His narrative was fragmented and largely incoherent. When I asked him if he had been in therapy before for any of these issues, he got quiet. After a period of silence, I inquired if he had been seeing a medical doctor or was on any medication for his condition. Then he aggressively snapped, "You stupid prick," and hung up. So much for my foray as a philosophical counselor. The next section is called Aristotle in the Asylum. By this time, I was employed as a clinical psychologist in a 40-bed adult inpatient psychiatric unit of a general hospital. I was assigned my own individual caseload, but I was also responsible for running a daily therapy group with the residents. Many of the patients were thought disordered, depressed, suicidal, and florally psychotic, with a pronounced history of trauma, hence presenting in acute distress. All of them, and this is pretty typical of Canada, were doped up on psychotropic medication prescribed by staff psychiatrists to help curb their severe symptomatology. Group attendance was mandatory for those who were not actively hallucinating, catatonic, or otherwise unable to participate. It is here where I decided to experiment with running the group more like a salon or a philosophical cafe, given I had a captive audience. In an attempt to provide some structure, I decided to give a brief lecture on the anti-psychiatry movement and introduce Thomas Szasz' classic essay, The Myth of Mental Illness, where he argues that mental illness is a social construction and a convenient myth dominated by the politicization of psychiatry, content on causally reducing human suffering to a neurochemical disease or physical disorder of the brain. Rather, Szasz focused on the phenomenology and hermeneutics of problems in living and in choice and responsibility, hence criticizing the ethics of reifying symptoms as biocausal correlates of psychopathology. After introducing the notion that the concepts we use to describe personal problems in living often have political motivations and do not accurately capture the non-pathological quality of one's life, the group could not accept that their symptoms or conditions did not have a biological, genetic, or physical cause. In fact, they deferred to psychiatric authority as providing a so-called scientific explanation for their condition that medication was supposed to remedy. Any attempt at reframing the issue was largely experienced as an invalidation of their suffering. Thinking that a closely related yet different philosophical topic could be broached more effectively in this forum, I ran a second group introducing Camus' discussion of the myth of Sisyphus and the absurdity of existence by reading out loud his famous dictum, quote, "There is but one truly serious philosophical problem, and that is suicide. Judging whether life is or is not worth living amounts to answering the fundamental question of philosophy," end quote. But rather than being intrigued by Camus' provocative prompting us to question the meaning of life, many of the group felt that life was meaningless and indeed absurd, and what better reason than to take your own life and be quick about it in an effort to end one's suffering. In my plea to introduce the notion that answering this question is contingent upon the possibilities and delimitations of creating a more meaningful and fulfilling life for oneself as a salve to existential absurdity, this triggered a collective regression. The group became preoccupied with depression and death, coping with emotional pain, and fantasies of suicide. Many in the group had then disclosed their own suicidal feelings and past suicide attempts, hence fueling an affective contagion of despair and hopelessness. Many started to cry lugubriously as they plummeted into the depths of their emotional pain. The discussion could not have gone more south, as I was left having to shore up their vulnerabilities and preoccupations with their traumas and broken lives. The session soon devolved into a support group atmosphere. My final attempt at a philosophical intervention in a inpatient psychiatric ward was to shift gears and talk about what most people would find non-controversial nor threatening, namely, what makes for a good friend. This time I announced the group therapy meeting on the ward as a, quote, philosophical cafe, where we would be discussing an educational topic for anyone interested in attending. I had even catered in coffee and cookies and broadcast the event on the ward speaker system that refreshments would be served. In introducing Aristotle's theory of friendship in the Nicomachean Ethics, I presented his classification system and hierarchy of friendship as constituting mutual affection, pleasure, utility, and authentic relatedness involving reciprocal admiration, love, and virtue as integral to one's happiness. In inviting an open discussion about what true friendship consists of, a woman immediately started to sob, clamoring, "I have no friends." Others chimed in about the paucity of anyone in their life who gave a goddamn about them, let alone having genuine friends. In allowing each person in the group an opportunity to speak, very few spoke of having any satisfying relationships at all. Everyone they leaned on or trusted, even immediate family members, were exploitive, demeaning, rejecting, invalidating, or simply a toxic presence in their lives. A new resident started bawling her eyes out as she spoke of her recent suicide attempt because her husband and children showed no appreciation for her at all. It was a typical day in the hospital. People were saturated in psychic pain, and the group ended in a cry fest. In retrospect, it appears obvious why this experiment was doomed to fail. How could we have a productive philosophical discussion when everyone was so ill that they had either succumbed to malaise or madness? Irrationality, cognitive distortion, and the traumatic residue of their life histories fueling such debilitative symptoms dominated by emotional upheaval and affective dysregulation, were completely alien to rational reflection or intellectual discourse. I might as well have been talking to myself. The final straw. In addition to my employment in the hospital, I had also rented an office and opened up a small private practice where both the types of clients and their less austere profiles were more conducive to culling philosophical reflection. But I had still encountered the same problems in cultivating genuine philosophical engagement in therapy due to the fact that the majority of patients presenting issues revolved around psychological themes and clinical symptoms. No one was interested in examining their lives logically, let alone coming for virtue therapy in search of the categorical imperative. And given that people have to pay good money out of pocket to ponder the universe, no one was coming into my practice under those circumstances, not even the worried well. The last referral I received from a colleague for PC was from a philosophy professor who had given my name and contact number to a prospective client, specifically seeking out philosophical counseling. Finally, I thought, this should pan out. Manuel was a conductor traveling with his orchestra from Spain. He was to spend several months in Toronto and had heard about philosophical counseling based upon Marinoff's book, presumably by this time translated into Spanish. He sought a consult from a philosopher at York University who had passed along my name. In the initial consultation, Manuel presented as someone who felt, quote, unfulfilled in his life. He spoke excellent English, having studied in North America, and had a successful career. A self-described, quote, obsessive about his work. Despite his achievements and accolades, he still struggled with poor self-esteem. He could not pinpoint the source of his feelings of discontent, only that maybe he should marry a woman and this would help. Upon further dialogue, he revealed that he had been living with a man for several years, but did not identify as gay, although he was still somewhat confused about his sexual orientation. In classical psychoanalytic fashion, he went on to associate about being attracted to men's feet ever since he was 8 years old, and particularly recalled being excited by seeing men's bare feet in communal showers. It should come as no surprise that he frequented men's bathhouses when he got older. In Freud's famous paper on the infantile origins of erotic fetishism, he notes how human feet or shoes may symbolize the desired phallus. For Freud, quote, the fetish is the substitute for the penis, end quote. Manuel's apparent ambiguous sexual orientation appeared to serve as a form of disavowal of his own sexual preferences, revealed as a split in his ego. Internally divided between his erotic object choice and identity, he was faced with the necessity of constructing a defense in the service of repression. It was only on the condition that he was not homosexual that he could marry a woman and heal the split in his ego and reconcile, hence abandon, the fetish object. But to do so would be to abolish his love for his partner and confront his inner psychic contradictions in identity and desire that were unconsciously conditioning his gnawing feelings of living an unfulfilled life. When the conversation steered more into the territory of personal and sexual identity diffusion, what we might refer to as queer or transgendered identifications by today's standards, any philosophical pretense to discussing the self as a social construction or a creative act of self-design, soon collapsed in the pressing emotional immediacy of his existential plight. And this, I realized, was the last straw. My attempt to sustain a philosophical practice suffered from an inherent biased flaw that the human being can be neatly partitioned off into a rational entity versus a psychological being, where neither the two shall meet. Just as the cogito cannot exist without a body, neither philosophy nor psychology can remain within their own respective insulated frameworks or modes of discourse without sacrificing a more holistic appraisal of what constitutes the human subject. Every form of philosophy is an expression of the psyche, just as every psyche is an expression of our psychological embodiment. Philosophical postscript. Where all of this left me was that my attempts to interject philosophical scaffolds into clinical practice were all but a failed enterprise. The most I could hold on to was a phenomenological analysis of clients' lives through an existential inquiry into why they struggle and how we may go about engaging in inner work needed to transform their current unhappiness or perceived pathos. Despite the fact that since antiquity, being human is to face the intrinsic disposition that we all suffer. Attempts to address or ameliorate our pathos is fraught with denial, internal resistances, and defenses designed to protect the self from internal disruption or collapse. A philosophical curiosity can easily slip into rationalization, intellectualization, or compartmentalization of affect, much like the Stoics, where control over world and mind largely becomes, with qualifications, an illusory attitude. But when combined with an existential attitude, namely the realization that suffering is rooted in ontological insecurity, lack of meaning, alienation, isolation, and tussles with actualizing human freedom, choice, and responsibility, concerns about life, death, and anxiety may be recast as the potential to become and fulfill your possibilities. As Plato observed, there is no bifurcation of psyche into discrete entities where reason, nous, desire, eros, and moral judgment, ethos, exist in a vacuum. These components and interactive dimensions of esse and anima pressurize the interior unconscious dynamics of the soul, which ultimately affect our psychological well-being. That is why I ultimately gravitated toward an existential psychoanalytic praxis, where I was afforded the flexibility to blend both philosophical and psychological perspectives in my clinical work, each tailored to the unique subjective needs of clients in search of a discovery of being within an authentic individuation process by embracing the complexity and ambiguities of life. When people develop higher order capacities in personal awareness, self-reflection, and acquiring insight into their unconscious interior, philosophy becomes a beacon for pursuing a better existence. Thank you very much.
Thank you so much, John, for that eye-opening discussion of your journey to your approach on existential psychoanalysis. Questions? Anybody have?
Yeah, I have a little question. Can I pose it?
Sure can.
Thanks for that talk. I found that very, very interesting. And I guess maybe I have a comment, and maybe you can comment on it. I'm not sure I can quite formulate it as a question, but I'm thinking, I mean, one of the appeals that, and philosophical counseling is completely new to me. My doctorate's in philosophy and I teach philosophy. But one of the appealing things about the idea of philosophical counseling compared to something like therapy is that it seems like, there's no diagnosis. It's not you're not really like a doctor with a patient. It can be something that's like quite egalitarian. And I'm also thinking about like the potential democratization of philosophy. Like it should be something that everybody can partake in because it concerns human life and things that are of universal concern. But what's interesting is that your experience seems to suggest that actually not everyone can really partake in philosophy, that if there isn't kind of like a baseline of health and stability in their life, that maybe it's really not so possible for them to engage or to have kind of like the conceptual background or the kind of emotional maturity or whatever it is to really participate. So I guess maybe I'm just curious what you make of that, or like how can you have, is philosophy something that has to be reserved for people who have quite a high standard of a good kind of baseline of health and stability, or how do you do philosophy with people who are pretty low in various capacities?
Well, yes, that's exactly my question. Why was I getting people coming to see me under the pretense of wanting to look at their lives philosophically, but they would bring in what we would call clinical matters, and it could be two things. It could be because of my profession as a psychologist, putting myself out that way, that I naturally would attract certain clientele. And it might be entirely different for somebody like yourself who teaches philosophy, says you're a philosopher, you have no identification with psychology, and it's less threatening for the general public or population to come in to see you under those conditions. And the second thing is it could simply be my personality, that I'm would give off a certain vibe or introduce a certain atmosphere that it was much more formal. So for instance, if you're paying a lot of money to come see someone out of pocket privately without insurance, you're going to feel all kinds of pressures to perform for clients, to perhaps show that you can have to earn your keep. I'm not sure how other people operate. I don't know how they function, but that could be some reasons why I was not successful at sustaining this kind of practice.
Thanks.
Other questions, comments? Carol, go ahead. Ray?
Hi.
Yeah.
John, thank you so much for that talk. It was very enlightening. I noticed in your introduction that you have a connection to the Adler community. And as a graduate, my clinical training was at Adler University here in Chicago. I was wondering if at all Adler has influenced your thought, particularly maybe his idea of superiority or his individual psychology.
This might come as a bit of a surprise, but I'm more of a Freud, Jung, and Lacan scholar. I didn't find Adler to be that deep, but despite teaching at Adler University in Chicago used to be the Adler School of Professional Psychology, and Toronto was our satellite branch before they had severed ties with the States. I always I've always appreciated Adlerians and admire. I have a number of friends who graduated from the same program you did, and actually I went to school in the 80s in Chicago, so Adler was a competitor at that time to other professional schools. But anyway, long and short of things is that even though I appreciate his psychology, I never really, taught it or gravitated toward it.
Yeah, thanks. Just to clarify, I'm not Adlerian, but I just wondered, if there's anything you kind of pulled from Adler that, But yeah, thanks for answering my question.
Yeah, my pleasure.
Farrell, do you have a question? Comment?
Yeah, actually, excuse me, my voice is a little scratchy today. Actually, I had a comment, but now after Dr. Mills' presentation, or his answer rather, to Mr. Glass, I'd like to know, how do you see Jung and Lacan as compatible?
Well, there's some things that are compatible.
How do you incorporate them both? That's it.
Well, that's a complicated question. So for Jung, before even Lacan's system, the symbolic was always there. It was always superimposed on the psyche. Of course, Jung has a view of the collective unconscious, or more of a universal psyche that resides in us all. And hence, Lacan's notion of the symbolic register or language and culture could fit into that, but the two are ultimately incompatible because Lacan in many ways denies human agency and freedom. Mm-hmm. Everything comes from outside. So whether it be language, culture, or the symbolic is superimposed. Images are imaginary and they're constructed in fantasy. But he does allow for the notion of the real, which is really our embodiment. But it's also that ineffable realm of the Ding und Sich. You can never know it in itself, and it seems to be more of an enigma. So in some ways, Jung would also be talking about the autonomous unconscious forces in the psyche that are operative at all times, and we're not fully in control of them either. So the issues around agency are different for the two, but Jung's ultimately an existentialist. I mean, he's talking about you have to embrace psyche. You have to live up to the responsibilities of who you are, your nature, and whether it be good or evil. And that's what we struggle with. And struggling with those autonomous forces in the psyche is what leads to integration, and what leads to what he referred to as an individuation process that's unique for each person. So there's where he kind of trumps Lacan, who I believe is in many ways an ontological reductionist.
Can you elaborate on that, please? Could you elaborate briefly?
Okay. I think if Lacan would probably, at least from his writings, the way I interpret it, would say that that the environment determines who we are largely. Language and the structure and social structures are imposed on us, And we're not really in control of our own desire, because desire is always something that precedes us. It's always the desire of the other that imposes itself on us. We don't have our own desire. We are others' desires that then get constellated. And so in many ways, it's still rife with interesting discussions, because people on some level who feel like they really have no control or choice in their life, they don't have really an agency, they don't feel free, is struggling with how does one deal with these forces that are outside of ourselves that impede upon our living.
So you synthesize both in your work with patients?
I just usually keep these things in the background.
Excuse me, I'm so sorry.
Okay. I don't impose a theoretical model on clients. They often wouldn't know where I'm coming from. I kind of steer them down a path based upon, once I get a sense of who they are and where they need to go. And in many ways, I would say I work dialectically. That I'm more about asking questions and opening up areas that are hidden, that are operative, at least I think are operative, but are not being spoken about. And when we get into that, the process just takes on its own life.
Mm-hmm. Now, I was curious because it seemed to me an improbable duo. Yeah. Well, thank you very much for your extensive answer.
Oh, well, thank you.
Appreciate it.
John, it's often said that cognitive behavior therapy is incongruent with, just incompatible with psychoanalytic methodologies. What's your take on that? I mean,
well, it's actually a myth. Aaron Beck was an analyst. So what we talk about.
So was Ellis. Yeah, right.
Yeah. So was Albert Ellis, who I had met at a training workshop once, but not like you, where you had much more of a mentorship with him. But the reason is that before any of these disciplines popped up, classical psychoanalysis has always been talking about the ego and the ego functions. And the ego functions are reason. I mean, they're looking at things, rationally, logically, cognitively. That these are the higher order functions of psyche that more or less govern consciousness. And so the way a person constructs their identity, the way they think, the way they are bombarded by impulses, internal conflicts, irrational desires, they all they supervene over the ego. So the ego psychologists were really the first people to want to focus more on cognition and focus on adaptation. And so the cognitive behaviorists today, either they don't care to read, history, or they want to, ignore it, or they want to minimize it, or they want to set it up as a straw man because of political identifications. So now we all do CBT. I mean, this is in graduate school for psychologists, this is the basic skill set you're taught. I mean, if you don't have the most basic things in being able to understand how a person structures their world cognitively, and what is adaptive and what's maladaptive, what they're aware of, what's outside of their awareness, how it deals with defenses and things like this, then you're probably not very good at what you do. It's just the main difference would be that the psychoanalytic camp would want to place the emphasis on the ontology of the unconscious, and that the cognitive folks want to place it on consciousness. And so to me, we don't have to have an either or, and we don't even have to have a pissing match about who's better. Because in reality, if you were to talk to any good CBT practitioner, they're using psychodynamic techniques. Yeah, Jonathan Shelder wrote a influential paper in the American Psychologist maybe 20 years ago, showing the efficacy of psychodynamic approaches over CBT approaches. And again, I don't see any need to bifurcate the field to say this one's better, that one's inferior, when they're coextensive and both operative, and any good practitioner is going to utilize these techniques, if you want to call them techniques.
That's my impression, and my recent work has been done with incorporating psychodynamic approach of Freud into LBT. And, it might have sounded like a strange brew, but the more I work with it, the more evident it becomes that the tripartite division of the human psyche fits well into the, framework of LBT. So I resonate with what you're saying. Are there any other questions? Anybody have any other questions? Well, we're out of time. We're 1 minute over, actually. So if there are no further questions, thank you so much.
Dr. Cohen, can I ask one last question quickly?
Oh, sure. Yes.
Yeah. Good evening. Thank you for your presentation. It was very interesting. On the other hand, it struck me, as a little bit pessimistic about the prospects of philosophical counseling, or at least a certain way of doing philosophical counseling, and so that, one that tries to help people who are, suffering from, mental disorders, mental illnesses, so they don't have the rationality, the presence there, the abilities, the skills to be able to engage in a philosophical conversation. Right. Or on the other hand, there's this also other theme about, approaches to philosophical counseling that presuppose the wrong conception of the human being or the psyche as, compartmentalized into reason versus emotion, or reason versus will, or reason, mind versus body, and so on. What I mean, and so. But but do you have reservations as well to, like, for example, in logic-based therapy, there's this, as I understand it, obviously Dr. Cohen is the authority here on that, but that's the kind of framework that I'm trying to use to help, people, thanks to Dr. Cohen training me, right? And so this idea that there are, there's a handful of the problems of living that they can appear in the in a clinical setting, but also can, we all share these problems, and that if they can be, and often, not always, but often they're not necessarily rooted in mental disorders and mental illnesses, so you can actually treat them by focusing on the rational beliefs of the person, the so-called cardinal fallacies, and then refuting them and trying to replace them with the corresponding virtues, using philosophical antidotes. Right? In that somehow you can do that without not ignoring, but not directly, because you're not trained for that, and you're not you know, not dealing with the psychological, so some broader psychological reality that may be influencing the client. Well, at least you can bracket that, right? I mean, and then focus on these beliefs that are reproducing, whatever self-defeating emotion and behavior they're creating. And so, are you skeptical of that as well? I mean, and so it wasn't clear to me whether and would that count as an attempt to separate? Because I mean, Dr. Cohen always talks about how, well, this is my interpretation. I mean, how obviously philosophical counseling and in psychology, psychotherapy, the empirical sciences are complementary. They're not at odds with each other. You can't, but the way you deal with the broader if there is any broader psychic reality or issue that the client has that you're not trained for, is to refer them to a psychologist, and maybe complementarily you enter as a philosophical counselor to kind of continue intervening perhaps. And so are you skeptical of that as well? Or especially if the person who's doing it, like me, I'm a philosopher by training, and I teach, but I'm not a psychologist. You mentioned that that philosophical counseling should be seen as a species of psychotherapy. So, and the people should be trained as well in the empirical sciences. Otherwise, you cannot really. That's the kind of impression that I got from your talk. So, what do you think about that? I mean, and so, are you skeptical about that as well, or?
No, these are really good questions. Personally is different than professionally. So one is just because I was not successful at it 5 years ago, or more than that, it doesn't mean that other people will not be successful at it. And the public has the right to choose different interventions that they think might be helpful. The one thing that I was concerned about back then, that I would still be concerned about today, is how do you know when you might be hurting somebody, or how do you know you lack competence in something? And so all I'm saying is that if people have different skill sets that they can fluidly apply to certain situations that would pop up in your practice, then that's what I think a more conscientious practitioner should be about. They should know the mental health literature, or at least they should have some training in mental health to know when, if it's a person's not a suitable client for philosophical reflection. And those are things that I wouldn't take lightly. The last thing somebody needs is to have somebody commit suicide on them because they didn't know what they were opening up in the session, or that they didn't see the signs or the symptoms, or they don't. I'm one practitioner up here in Canada was seeing schizophrenics in outpatient. And I thought I was quite critical about that. You can't have a discussion about, I think they were talking about the qualities of Jesus and Kant's ethical philosophy, and how is that going to go over? So these are the things that one should always know their limitations, and stay within their scope of practice and their competency. And again, if this is an adjunct, meaning philosophical counseling is an adjunct to other person's mental health treatment, that's a different issue. But you would hope to get people interested in your services because you have something unique to offer that the psychologist or the therapist doesn't.
Right. Well, thank you so much, Dr. Mills. Wonderful presentation.